So we'll start with the lower lip. The lower lip usually is less, tender and less sensitive than the upper lip. So that's why I like to start with that. Now we're doing what's called the Swift technique. So basically, I'm injecting the filler and start advancing. The good thing about this technique is that because the filler has numbing medicine, so with each injection I'm numbing for the next injection as well, because this is what we already injected here, so that should have some lidocaine, so to be a little bit numb, the entry point. And then I'm stretching the skin a little bit so that I stay at the same depth, and a little bit different thread here, and I always immediately gently massage as well. We do it that way, and I don't, in sometimes they recommend that the patient massage the lips themselves after the injection. You shouldn't need to massage anything after. Again, and we keep advancing like that. How do you feel so far? Good. Yeah, perfect. Again, I mean, number one objection, or number one people are fearful of lip filler is that they think it's going to be really painful, and honestly it's not, and it shouldn't.
Yeah, I get a lot of tattoos, so.
Yeah. Yeah, this should be easier as well, because she's been numbing outside for like half an hour or so. The numbing medicine we use here is really good and strong. So, and again, the lip filler, if you're not allergic, which most people are not, lidocaine, then as we're injecting, the filler has lidocaine, so there'll be even more numb. Okay, and then we're just advancing. We're almost, as you say, done with the lower lip. And then we're already at 0.4 cc. I'm using Versa Lips. It's really a great filler for the lips. And it has the syringe 1.2 cc, so it has 20% more volume than other fillers. It doesn't mean that we necessarily use the whole 1.2 cc, but at least if we need more, at least we can adjust, or we can use this extra 20%. And I'm almost again at the corner, and I look, and if everything is fine, then we're done with the lower lip. Okay, you see all that little blood, that's all superficial. Doesn't seem there's any bruising so far, so that's not gonna bruise. You bruise when you bleed under the skin from a vein. So this one will just clean a little bit, and a few minutes, seconds, it will go away. So far looks good. Maybe a little bit more here. A bit from the other side as well.
No.
That's good. Yeah, it's like magic, man.
Yeah.
Okay, so now I think it's better, come from this side. So, and then we're done with the lower lip. Again, you can see the upper lip. I'm having also still the numbing medicine. I don't need to wipe it until I'm ready, so I'm leaving it to numb more. Okay, so that's good for the lower lip.